Treating a serious bleed.
Sophia, have you cut your arm? Can you put your hand on that for me? Good girl. Now lift it up in the air. I've asked the patient to apply pressure to the wound to hopefully slow down the bleeding. By elevating it, this should also help too. This allows me to go off and get some gloves and to prepare my first aid kit. I've put some gloves on and I've got a bandage. This is a clean, medium-sized sterile bandage from my first aid kit. It comes with a short side to the bandage, a wound pad and a long side. On the count of 3, Sophia, I want you to lift your hand, okay? So you can take your hand off and Mummy put the wound pad on. 1, 2, 3, there we go. I'm going to hold pressure on at the wound site and apply the wound pad to it. I'm then going to wrap the bandage round, applying adequate pressure to stop the bleeding, but not so much pressure that it cuts off her circulation. If the bleeding comes through the first dressing, take it off and start again, applying slightly more pressure. You can then check if it's too tight by pressing on the nail bed for 5 seconds. The skin should turn white and then back to pink within 2 seconds. Some people do have a slower capillary refill if they're cold. You could then compare the capillary refill with the other hand. If they take the same time, that's good. If the hand in which the cut is takes longer, this is a sign that you've restricted circulation. Okay, so that dressing has stopped the bleeding. I need her, this is a serious bleed, so I need her to keep her arm elevated. Is it uncomfortable to hold it up the whole time? Yeah, so I think we need to put on an elevation sleeve. So I'm taking a clean, non-woven triangular bandage out of the packet. And just like the name suggests, they are triangular shaped. I'm going to start by applying a knot in the tip of the triangle. Sophie, can you hold your arm up here across your chest for me? I'm then going to hold the sling up to her. The tail of the knot is pointing out towards the wall, not towards her other arm. And the longest point of the triangle, the bottom of the triangle, is running vertically down her body. Hold that right up on your shoulder, darling. Once the sling's on, depending on the patient's size, like Sophia, she's a little bit small, the knot might need adjusting. So you can then come and tighten, you can either undo the knot and then redo it tighter, or you can apply safety pins